Hi, thanks for being here today. My name is Lindy and I'm your host, and I welcome back Dr. Russ Van Maele to my channel. And today we're going to hyper focus on hypertension or high blood pressure. So stay tuned if you have high blood pressure and want to lower it under the supervision of your own doctor, or good blood pressure and want to continue to maintain that. So Dr. Van Maele is a physician and he's going to share his top tips of how to do this. So take it away, Dr. Van Maele.
Sure. So, as you said, blood pressure is a major problem in the primary care world and just all of medicine. It's one of the top conditions that we have to treat. But a lot of times it's due to a lot of environmental factors that we deal with. So, if I had my top three things, which is going to sound cliche, but it's by far the best medicine that we have, number one is always going to be exercise. You have to be exercising. And that really kind of creates your arteries into more of a rubber band. As we age, our arteries are getting stiffer and stiffer and stiffer. If you think about how if you have to shove water through a pipe, if the pipe is really rigid, you have to do a lot more pressure to get that water through that pipe. So we do not like stiff arteries. Exercise is one of the best ways to expand and contract, expand and contract. We want to have elastic arteries. Exercise is by far one of the best ways to do that because your blood pressure is going really high during exercise, but it's that downfall after exercise, which is the big player in how that helps to reduce your blood pressure.
Is there a specific type of exercise that you promote, or is it just what works for, each individual patient?
I don't know that there's any studies of like this exercise is better for blood pressure than that exercise. I would say the better ones for blood pressure would probably be HIIT workouts because you're going to get your heart rate and blood pressure really high, but then it's also coming down significantly, kind of what I just alluded to. But I don't want people to get caught up in the weeds of like, I'm only going to do this exercise if I have high blood pressure. Because really at the end of the day, I want people moving. I want people exercising as much as they can and find something that they like to do, like what you just said.
Yeah, I like that you said that. I think it's not a one size fits all approach. So perhaps you, like me, I tell my patients, what do you like? Because that's going to be the most sustainable. We want you to do
Mm-hmm.
this and enjoy it. So
Yeah.
exercise can look like different things. It doesn't have to be HIIT workout,
Nope.
especially if you have joints that don't respond well to that. But
Sure.
yeah, finding like what you like.
Longevity too, right?
Hmm.
That's what the definition of a yo-yo diet. Somebody tells you to do something that you really don't like to do, and you get, wanting to do it for a few weeks, and then you realize that you don't really enjoy it. So find something you like to do. Make sure you're moving while you're doing it too. So second tip. So first one's exercise. Number two is going to be what you eat, what you put in your mouth. So what I deal with on a day-to-day basis is insulin resistance. And insulin resistance is one of the biggest, the truest epidemics that we have in our world today, just based on the foods that go into our body and the processed foods, the high sugars. And this kind of goes into the same concept of the elasticity of our blood vessels. If we have insulin resistance, we are chewing into our vessels with the amount of sugar, processed foods, the seed oils, grains, I'm not a big fan of either. And all that damage has to be repaired. And if you think about it, you're just constantly repairing, you're going to run into problems. Because think about the pressure to shove water or blood through this hole versus the same pressure to push through this hole, right? The pressure has to be a lot higher to get through this hole. It's very similar to a hose, right? You have a hose wide open, flows really nicely. But then you put a back pressure on with your thumb and it just spits out. That's a problem. That's what most people are dealing with. So
So are you saying that's like the analogy of insulin resistance, right? The narrowing of those arteries that the blood has to pump through?
yes,
Okay.
because you're
And
doing damage to your blood vessels.
so how does one get to insulin resistance for folks that might not have heard that term before?
It's kind of like the pre-diabetes, right? when we establish an A1C, that's a great way to look at it, looking at fasting insulin, looking at a lot of biomarkers that would indicate you have insulin resistance. But bottom line, it comes to your body's ability to process glucose. And actually, the more glucose you take in, your body becomes resistant to pulling that glucose out of your bloodstream with insulin. So the body just has to crank up insulin and insulin and insulin and insulin to the point where we become insulin resistant. And that is a major cause of heart disease, Alzheimer's, premature death, all the things that we're trying to rid of right now.
Okay, thank you. So what specific foods should people be focusing on if they are working with their doctor to lower their blood pressure? What would you recommend?
Sure. So the way this is kind of goes into the exercise thing. I ask people, what do they like to eat? Right? Because that's the same kind of concept of here's a diet, here's X, Y, and Z that I want you to put on your plate, and people get really excited and they make this plate, and then it takes them an hour to do, and then after a couple weeks they go revert back to old ways. So I ask them, like, what are the things that you like to eat? And if they like to eat all vegetables, we'll say, hey, let's make the best of these vegetables, right? Avoid using seed oils, avoid using extra grains, like keep those carbohydrates more complex as opposed to simple, right? Same thing with meat eaters, right? If you want to eat meat, great. Just don't add junk to it. The steak and potato or baked potato analogy, it makes this kind of stigma against the meat eaters because we are a lot of times having a beer, burger with a bun and fries, and we're called a meat eater when really the meat is a very insignificant portion of that plate. Most of it's actually junk. So you got to get rid of the things that cause insulin resistance. And that's what I kind of communicate to my patients. Like, eat what you want as long as it doesn't have these things.
So you're saying, so that in this analogy, like maybe steak and potato wasn't the best way because now people think that that's, but those are bad foods, right? But a potato is more of a complex carbohydrate, as you're saying,
Right.
whereas like a bun that's loaded with sugar and that refined carbohydrates might lead to insulin resistance if that's the bulk of your diet. Is that what you're saying?
Exactly. And when I
Okay.
kind of refer to a potato, I mean like the loaded baked potato with fake sour cream, with fake cheese, with fake bacon bits, the kind of adding
Or
sweetness,
French
adding
fry
extra
and
flavor, or
that's
French
fried in seed
fries.
oils.
Yes, exactly. They're just overusing those oils over and over again. And that's obviously not healthy for us.
Okay, so when you're talking to patients about if they say they eat a lot of packaged food,
Mhm.
how do you handle that if their goal is to improve their metabolic health numbers?
Sure. So I think there's a lot of companies coming out that are making convenience healthy, and I think that's great. But you need to take it one step better because once again, follow the money, right? That's a company. They want money, right? They're going to take your money happily, right? They probably want you to like their foods. In order to like their foods, generally they make them sweeter, more palatable, right? And we need to take it one step better to say, all right, I've done my research. I look at this packaged food. What's actually in it? Because what they can't hide from you is the ingredients, right? They can say whatever they want on the front that it's heart healthy, or this is keto friendly, or gluten free. But at the end of the day, you have to flip that, whatever that package is, and look at the ingredients, right?
Okay.
You should be able to count it on one hand what's in it. So that's what I teach people a lot of times is you got to know what you're eating. And if it comes in a package, that should be a red flag. And you got to be smarter than the person next to you that's not paying attention to that. Because
Yeah.
one of you is going to be healthier and one of you is going to kind of follow this circling of the drain into insulin resistance and diabetes.
And when I had you on my channel before, you and I did more of like a deep dive into, what people should be eating. So
Mm-hmm.
from that conversation, I know that you're really a big advocate of like eating real whole foods, right?
Yeah.
Having an orange instead of the orange juice,
Mm-hmm.
having a baked potato instead of the French fries that are in the freezer section. So I think keep it as simple as possible is what you've told me before.
Yeah, simplicity is key. And so many people are having these nutrition wars these days of what's the better food to eat. And then what I find is a lot of people kind of throw their hands up in the air and they say, well, everybody's just arguing and who knows what the right thing to eat is, so I'm just going to eat whatever I want.
Yeah.
And it's kind of sad because nobody's necessarily wrong. The vegans aren't wrong. I don't think the carnivores are wrong, right? That's two ends of the spectrum. I think, my typical style of eating is more omnivore. I love like the classic like meat and veggies type of diet with some fruit. But at the end of the day, 90+% of the time, I'm able to look at my food and tell you 100% without a doubt what is in the food or how it was prepared.
Yeah, that's my philosophy as well. I am definitely an omnivore, but that works best for my body. So
Right.
just like you, we probably encourage our patients to find out what works for you, right?
Exactly. Exactly. That's how I always start out the call. Like, what do you like to eat? And
Yeah,
if somebody tells me a hamburger, I'm like, all right, let's find out how to make a hamburger better.
totally. Or a homework assignment I give my patients because I'm there to help them build muscle, so we have to have
Mm-hmm.
the conversation about, well, how do we do that? It's not just strength training, like we have to fuel our body.
Yes.
So the first homework exercise I give is to make a protein list of the proteins that they like, right?
Yep.
And their list is going to look different than mine, and it's going to look different than yours, and that's okay.
That's okay. Yes, that is very okay.
So anything else on what we should eat before we go into your next tip?
Yeah, I think the big three that I counsel my patients on actually, I have two major rules. Number one, don't drink your calories. You should be drinking just water. That's what we were evolved to consume, and you don't need anything else. Don't make it complicated. Just drink water.
Okay.
Black coffee I'm okay with because it has 0 calories in it. Don't add anything to it. Black tea has 0 calories in it. But you should never be adding anything. And I'm talking about any sweetness. I'm even like stevia and sucralose and monk fruit and all these extra sweeteners.
Honey?
I just have a feeling one day we're going to regret putting stevia into everything because we've developed this sweetness palate that really carries over for the rest of the day because now everything has to be above here for it to be sweet, and that's a major problem. So number one, don't drink your calories, and then number two, like kind of what I was talking about, know 100% of your ingredients, and in that subcategories, processed foods and sugars, staying away from seed oils that I know you've talked about several times. And then the third one is grains, right? These are simple carbohydrates that are going to spike your glucose, spike your insulin, and are a major player in the inflammation and insulin resistance game.
Wow, thank you. That was really succinct.
Keep it simple.
Keep it
Don't make it
simple.
complicated.
Love it. Doesn't have
Yeah.
to be complicated.
No,
In
it
fact,
doesn't.
that makes it harder.
Exactly. Exactly. So number one is going to be exercise and just movement. The harder you push yourself, the better. Number two is going to be what goes in your mouth. You got to control that, right? We have to control what goes in our brain. That's going to affect our thoughts and emotions. The same thing on the inside. Got to, manage what goes in our mouth. And then number three is stress control. And this is the hardest one because we live in a society where we're just go, 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 and we're very busy people, right? Most people don't settle down and they're constantly wired. I know for me, this is a big problem, right? It is.
Me too.
I would love to kind of break this in half sometimes and throw it out into a lake somewhere. But we need to disconnect because once we do that, we can really get into that kind of relaxation state, activate those parasympathetic activities because most of the time we're just in this sympathetic drive, which is adrenaline, norepinephrine, which is things that are cortisol that are raising our blood pressure, right? We need to be alert. We don't want to screw up We need to have our finances in check. We need to get our relationships in order. And if they're not in order, then we get even more stress, and then it compounds and compounds and compounds. So that is such a key player, is disconnecting and finding, once again, what do you like to do, right? Meditation, mindfulness. These are things where you're totally disconnecting. And I even take it one step further. One thing I love to do is add in movement with that mindfulness. One of my favorite things I love to do is honestly is go, hang out with the chickens. It's like my end of the day thing, that I'm carrying 50-pound bags of corn on both of my arms, doing a farmer's carry, right, all the way 100 yards out to my backyard to dump it in. And then I just kind of stand there, to be honest, and I just watch them. It's like watching a fire burn. You can just watch it for hours, but it's relaxing me, and I feel completely disconnected. I never bring my phone in there, and that's one of the ways that I really just pull the plug and remove myself from the world. And
That
then
example included all three of your tips, by the way.
it did, right? Because you can talk about the eggs, you can talk about the
That was
exercise,
pretty
and you can talk
good.
about the mindfulness.
That was pretty good.
And
What are
then,
other ways you manage your stress, you and your wife? You guys
yeah,
have a new baby. Congratulations,
we
your first
do have a
baby.
new baby. So we're very, very blessed. So, and we give that all to God. Like, we're very devout Christians, and it's always a work in progress. But prayer, I would say, by far, just giving thanks to God for this life, and for, our family, our marriage, having a safe and healthy pregnancy and delivery, and he's growing up so big and strong, and it's just, it's coming from a higher power, and he's in control. And honestly, when I tell myself that he's in control of everything, it kind of takes a lot of the pressure off of me, because I am very much I want to do it all on my own, and I get into these ruts where I'm trying to work, and provide, and the next thing I know, I'm screwing up,
Yeah.
and my relationship is suffering, and that's when I have to kind of hit the brakes and really kind of get back to my roots, and that is prayer and just being thankful for this life.
That's great. So you like to slow down, you like to get out in nature, you like to take care of your home, mindfulness, meditation, and your faith with your family.
Absolutely, absolutely.
I
And
love
one
that.
more thing I'll add on to that, which goes into the stress category, is sleep.
This is a biggie.
This is a big one, right? And it goes. You could talk. There's books written about, right. Matthew Walker, Why We Sleep, which is one of my
Fantastic.
initial functional medicine books to talk to people about. But think about what happens, and this kind of goes into like a secondary cause of high blood pressure, to keep it on topic. A big thing that people struggle with is being overweight, especially men over 50 that snore, that are tired all the time. This is all the criteria for sleep apnea. And that is a major problem in America, is because we're having all of these issues. We're not moving throughout the day, we're not eating healthy, and we are not calming down at night. When we sleep, our heart rate should be as low as it gets throughout the night, right? We're not moving. All we're doing is really breathing, and we have brain activity, right? But we're not moving. We shouldn't have stress while we're sleeping, right? It should be all parasympathetic activity. The sympathetic should be gone. However, you can introduce sympathetic activity, that fight or flight response, if you are not breathing when you sleep. And more people struggle with that than people realize. And it's classic, like a husband and wife will be sleeping in the same bed, and the wife will be to the husband like, whoa, wake up, you just stopped breathing. It's not that benign, right? Oh, just wake up, and the guy goes, oh yeah, we're good. No, that's a major problem. You
Right.
are exponentially jacking up your risk of atrial fibrillation, hypertension, heart disease, stroke, and honestly, a poor quality of life at the end of the day.
Yeah, and dementia.
And dementia, of course. Of course, you can extrapolate like poor sleep to so many different chronic diseases that we have.
Right. So I think that's where we need to talk more is like making the link. It's not just sleep apnea that we're worried about. It's not like you're loud, be less loud. It is because of this, you're at risk for all of these other things, right?
Right, right.
There's a web and they're all connected.
It is, everything is connected.
So if someone has sleep apnea, I think, it sounds like it's more common with obesity, correct?
It is. Yep.
Okay.
But at the same time, you can have skinny people that have sleep apnea too.
Right, right. That is what I've heard from some people that are working with that population. It doesn't necessarily have to be because of your weight.
Right. Exactly. So,
Dr. Kevin Stock, he is a dentist in the Missouri area,
okay.
and he runs a sleep apnea clinic, and he was discussing this too, and he has coined this term called fatty tongue,
Mm-hmm.
and he believes that that is a really big contributing factor to sleep apnea, and it
Sure.
doesn't necessarily have to be in somebody that is overweight, right?
Right.
And he is making that direct link to what we eat. He is an advocate of eating real, simple, whole foods, and then developing this quote unquote fatty tongue that he is, trying to research more about.
Sure. Sure. And I'll add one more nugget into poor sleep, which I'd have to deal with a lot, is alcohol. So if you want to
Yes.
talk about fatty tongue, I like the term lazy tongue.
Lazy tongue.
Because what happens when you drink alcohol, we get a little kind of loose, right?
Right.
Well, when you fall asleep, yes, it knocks you out, right? That's classic. I drink to fall asleep or drink to relax, and it helps me to fall asleep. Well, the other problem is your mouth, your throat, the muscles surrounding this, your tongue also gets a little drunk and falls back a little bit farther than it should. And everybody kind of knows this, right? When you had a night of drinking, maybe go back to college or whatnot, where the guy next to you passed out and he's just snoring like
Right.
a train, right?
Right.
Chainsaw
Right.
throughout the night. Everything's falling back on your throat, and if you try to, it's like kind of like a whoopee cushion concept, right? You're trying to blow an air through something that's flapping, right?
Yes.
Well, you're not getting all the air through. That's the problem. That's why it makes this sound.
That's interesting. I never put those two together.
Oh yeah, it's a major problem. So you do not want a fatty tongue. You don't want a lazy tongue.
Well,
And
you and Dr. Stock need to get together.
oh, I'd love that. I talk to people about sleep apnea all the time. I'm very passionate about it because if you fix it in the short term with a CPAP machine and long term with functional medicine strategies, diet, exercise, nutrition, stress, you are improving somebody's risk of disease and quality of life more than most interventions we have in America.
Yeah, that. Not enough people are talking about that.
No, they're not.
So thank you for bringing that up.
Yeah, absolutely.
Anything else you want to add?
No, I mean, there's a lot of different reasons why we have high blood pressure, right? There's things that we can control and things we can't control. Like, for example, some things that we can't control, age, our race. Things that we can control, how big we are, right? How much extra weight are we carrying? What are we doing to our body, right? Do you have insulin resistance? Are you not moving at all? Are you doing drugs? And alcohol is a drug, right? So making sure you remove the things that are hurting you first, and then addressing the things that sometimes you can't control after. And that's where a doctor comes into play, where we can either counsel you on, hey, no, you can actually fix this with lifestyle, or, you know what, I think you would benefit from X, Y, or Z anti-hypertensive therapy. So I think it's always good to get checked. And I'm a big proponent too of checking your blood pressure at home. That's, I think, a good thing to add as well, is that there's a thing called white coat hypertension.
Yes.
I like to think that when people chat with me or when I see them in the clinic or the office, that I keep them relaxed But at the same time, they're seeing a doctor where a lot of the times they're expecting to hear bad news, right? I'm not healthy. You're going to die. You're going to have cancer. You need to go on this medication because you have X, Y, or Z disease. That stresses people out. That's a problem if you check your blood pressure right there and then when you're in a state of fight or flight. That's called white coat hypertension. So your blood pressure may be really high in the office, but that's actually normal at home.
Yeah, I tell my patients that all the time. Most of them have a cup at home, but many don't, so they don't
Mhm.
know what their blood pressure is. And I'm always
Yeah,
like, you're not going to know what abnormal is if you don't know what your normal is. And
exactly.
then a second thing about that, take it different times of the day. Don't always take it at 8 a.m., right?
Mhm.
Because it is not a static number. It does fluctuate over the course of the day, and it's
Done.
going to fluctuate with other variables in the day, like amount of stress. So it's good to take it at different points during the day and then know your own data. Write it in a note in your phone or
Mhm.
whatever. I don't know if you have any
Exactly.
other tips for people.
Yeah, and I tell people find the calmest time of your day. Sometimes it is first thing in the morning, but a lot of times it's right before you go to bed.
Hmm.
And watch a YouTube video on proper way of taking your blood pressure as well,
Yeah, good tip. That's a
right?
good idea.
You can
Yeah.
easily, a classic one is you're taking it in your chair, your arms are like this, and you're crossing your legs. Well,
Right.
you're pinching the hose, right? It's going to
For
have higher
sure.
pressure. So you're going to get this false elevation, right? But there's a reason we sit you down with your feet flat, uncrossed. The cuff is at heart level, and that you're in a state of relaxation when you do it, right? But in doctor's office, we love the nurses and medical assistants love to just throw you on the table, get you on the chair, and be like, and you haven't even said anything, and you're kind of
Right.
freaking out inside.
Right. And you've walked in from who knows where, how long, from
Yeah,
exercising.
exactly. You just like finish your cup of coffee and put it back in the car, and
Right.
caffeine will make your blood pressure higher than normal. So there's a lot of factors that go into play here.
Yeah, be
Get to
human and
something.
one and play around with it.
Yeah, yeah. And we love data. Doctors love data.
Hmm.
So my favorite patients are the ones that know what medications they're on and why they're on them. And if they're on medications that we are trying to get them off of, for example, diabetic medications, I want to know your glucose. Antihypertensive medications, give me some blood pressure numbers. And we can make the decision right here if we want to decrease or even get you off of this medication, which is my goal for everyone, is to only be on medications if it's absolutely necessary. And if it's not, we get you off.
Um, well, thank you so much for your time. I think this was really helpful, and most people don't have the luxury of, sitting down and talking with a physician like you for, a half hour. So these three tips are really invaluable to a lot of people out there. So we really appreciate your time, Dr. Van Meele. I can't wait to have you on again for
Yeah.
our next topic. Any closing statements or?
No, I think like at the end of the day, right? Everybody is trying to be healthy, but don't miss the forest through the trees. Quality of life is very, very important, and disconnecting is just as important as being busy.
Yeah, for sure. For sure. All right. Well, thank you so much, and
All
I hope
right.
you enjoy the rest of your day.
Awesome. Great seeing you, Lindy.
Yeah, you too.